This video reviews the scientific literature on the relationship between water consumption and diabetes, focusing on studies that have explored the potential benefits of staying hydrated for individuals with this condition. Water intake and diabetes prevention. Several epidemiological studies have examined the association between water intake and the risk of developing diabetes. A study published in the journal Diabetes Care in 2011 found that participants who reported higher plain water consumption had a significantly lower risk of developing type 2 diabetes. This study analyzed data from over 3,000 adults, concluding that substituting water for sugar-sweetened beverages could reduce the risk of diabetes by 7 to 20%. Another study published in the journal Nutrients in 2018 examined the relationship between water intake and the incidence of type 2 diabetes among 12,017 participants over a 14-year follow-up period. The researchers observed a significant inverse association between total water intake and the risk of developing type 2 diabetes. Participants with the highest water consumption had a 24% lower risk of developing diabetes compared to those with the lowest water intake. Water intake and glycemic control. Glycemic control is crucial for managing diabetes, as it helps prevent complications such as cardiovascular disease, neuropathy, and kidney damage. Studies have shown that adequate water intake can have a positive impact on blood sugar levels and insulin sensitivity. A study published in the journal Diabetes Care in 2010 found that increasing water intake by 1.5 liters per day could lead to a significant reduction in the levels of the hormone vasopressin, which is responsible for increasing blood glucose levels. In this study, participants with type 2 diabetes who increased their water intake experienced a decrease in fasting blood glucose levels and an improvement in insulin sensitivity. Water intake and kidney function. Diabetic nephropathy, or kidney damage, is a common complication of diabetes. Maintaining proper hydration is essential for preserving kidney function, as it helps dilute toxins and waste products in the blood. A study published in the Clinical Journal of the American Society of Nephrology in 2016 examined the relationship between water intake and kidney function in individuals with type 2 diabetes. The study found that participants who consumed more than 2 liters of water per day had a lower risk of chronic kidney disease compared to those who consumed less than 1 liter per day. Water intake and body weight management. Obesity is a major risk factor for developing type 2 diabetes, and maintaining a healthy weight is essential for diabetes management. Drinking water can help with weight management by promoting satiety, reducing hunger, and increasing energy expenditure. A study published in the journal Obesity in 2010 examined the effects of water consumption on weight loss among overweight and obese adults. Participants who consumed 500 milliliters of water before each meal lost an average of 2 kilograms more than those who did not, over a 12-week period. The researchers concluded that water consumption could aid in weight loss and help manage obesity-related conditions such as type 2 diabetes. Water intake recommendations for individuals with diabetes. While there is no one-size-fits-all approach to water intake, health organizations recommend that most adults consume at least 2 to 3 liters of water per day. This includes water from beverages and food sources. Individuals with diabetes should consult their healthcare providers for personalized recommendations based on factors such as age, weight, physical activity levels, and overall health status. The importance of hydration during exercise for diabetic individuals. Physical activity is an essential component of diabetes management, as it can improve insulin sensitivity and help maintain a healthy weight. Staying hydrated during exercise is crucial for individuals with diabetes, as dehydration can exacerbate blood sugar fluctuations and increase the risk of complications. A study published in the International Journal of Sports Medicine in 2015 investigated the effects of dehydration on glucose metabolism in individuals with type 1 diabetes. The researchers found that mild dehydration, 2 to 3% body mass loss, could impair glucose metabolism, highlighting the importance of proper hydration during exercise for people with diabetes. The role of water in diabetic neuropathy. Diabetic neuropathy is a common complication of diabetes, characterized by nerve damage that can result in pain, numbness, and weakness. While the exact relationship between water intake and neuropathy remains unclear, hydration is essential for maintaining nerve health and function. In a study published in the journal Diabetic Medicine in 2013, researchers found that dehydration could exacerbate nerve dysfunction in individuals with diabetic neuropathy. The study revealed that rehydration led to significant improvements in nerve function, suggesting that maintaining adequate water intake may help alleviate symptoms of diabetic neuropathy. Hydration and the risk of hypoglycemia. Hypoglycemia, or low blood sugar, is a potential risk for individuals with diabetes, especially those who take insulin or other glucose-lowering medications. Staying hydrated can help prevent hypoglycemia by supporting proper glucose metabolism and reducing the risk of blood sugar fluctuations. A study published in the journal Diabetes Technology and Therapeutics in 2014 examined the relationship between hydration status and the risk of hypoglycemia in individuals with type 1 diabetes. The researchers found that participants who were dehydrated had a significantly higher risk of experiencing hypoglycemia, emphasizing the importance of proper hydration for preventing low blood sugar episodes. May help prevent and treat headaches. Dehydration can trigger headaches and migraine in some individuals. Research has shown that a headache is one of the most common symptoms of dehydration. What's more, some studies have shown that drinking water can help relieve headaches in those who experience frequent headaches. A study of 102 men found that drinking an additional 50.7 ounces, 1.5 liters, of water per day resulted in significant improvements on the migraine-specific quality of life scale, a scoring system for migraine symptoms. May help relieve constipation. Constipation is a common problem that's characterized by infrequent bowel movements and difficulty passing stool. Increasing fluid intake is often recommended as a part of the treatment protocol, and there's some evidence to back this up. Low water consumption appears to be a risk factor for constipation in both younger and older individuals. Increasing hydration may help decrease constipation. Mineral water may be a particularly beneficial beverage for those with constipation. May help treat kidney stones. Urinary stones are painful clumps of mineral crystals that form in the urinary system. The most common form is kidney stones, which form in the kidneys. There's limited evidence that water intake can help prevent recurrence in people who have previously gotten kidney stones. Higher fluid intake increases the volume of urine passing through the kidneys. This dilutes the concentration of minerals, so they're less likely to crystallize and form clumps. Water may also help prevent the initial formation of stones, but studies are required to confirm this. Significantly affects energy levels and brain function. Your brain is strongly influenced by your hydration status. Studies show that even mild dehydration, such as the loss of 1 to 3% of body weight, can impair many aspects of brain function. In a study of young women, researchers found that fluid loss of 1.4% after exercise impaired both mood and concentration. It also increased the frequency of headaches. In conclusion, water plays a vital role in diabetes prevention and management. Studies have shown that maintaining proper hydration can help reduce the risk of developing diabetes, improve glycemic control, support kidney function, aid in weight management, and alleviate complications such as neuropathy and hypoglycemia. Healthcare professionals should encourage individuals with diabetes to prioritize adequate water intake as part of a comprehensive diabetes management plan.
If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.